Are you busy and worried about not being able to read? Neonatal Resuscitation Program 8th edition? Well, worry not. This video will touch the overview of Neonatal Resuscitation Program 8th edition Practice Changes. Watch this video till the end and find out what the 8th edition of the Neonatal Resuscitation Program has in store for you. Released in June 2021 by American Academy of Pediatrics and American Heart Association. Well, without any further ado, let's start. The first change is in the 4 pre-birth questions. The NRP 8th edition has replaced "How many babies?" to umbilical cord management plan. Thus, the new 4 pre-birth questions are 1. Gestational age, 2. Amniotic fluid clear, 3. Additional risk factors, and 4. Umbilical cord management plan. The second modification is that the initial stages have been reordered to better represent standardized practice. So, in NRP 8th edition, the initial steps are warm, dry, stimulate followed by position, airway suction if needed. While in NRP 7th edition, it was warm and maintain normal temperature followed by position airway, clear secretions if needed, dry and stimulate. The third changes. Earlier in the algorithm, that is NRP 7th edition, the use of an electronic heart monitor is recommended. And thus, when performing cardiac compressions, an electronic cardiac monitor is the preferred method of determining heart rate. With NRP 8th edition, when an alternative airway becomes necessary, a cardiac monitor is recommended for the most accurate assessment of the baby's heart rate. The fourth changes. Epinephrine intravenous intraosseous flush volume is increased. In NRP 7th edition, the intravenous intraosseous epinephrine was flushed with 0.5 to 1 milliliter normal saline. Now, with the NRP 8th edition, you will flush intravenous intraosseous epinephrine with 3 milliliters normal saline, applies to all weights and gestational ages. The fifth changes. Now, in NRP 8th edition, the suggested initial intravenous intraosseous dose equals 0.02 milligrams per kilogram, equal to 0.2 milliliters per kilogram. And the suggested endotracheal dose, while establishing vascular access, is 0.1 milligrams per kilogram, equal to 1 milliliter per kilogram. Then, the final overview practice change in NRP 8th edition is expanded timeframe for cessation of resuscitative efforts. Initially, according to the NRP 7th edition, if there is a proven absence of heart rate after 10 minutes of resuscitation, it is permissible to terminate resuscitative attempts. Now, with NRP 8th edition, consider stopping resuscitation efforts around 20 minutes after birth if there is a confirmed absence of heartbeat. Decision individualized on patient and contextual actors. In a nutshell, the new NRP 8th edition's practices changes are: 1. In 4 pre-birth prenatal inquiries, ask umbilical cord management plan, rather than how many babies. 2. The initial steps are warm, dry and stimulate, instead of just warm and maintain normal temperature. 3. A cardiac monitor is recommended when an alternative airway becomes necessary. 4. Flush intravenous intraosseous epinephrine with 3 milliliters normal saline. 5. Initial intravenous intraosseous dose equals 0.2 milliliters per kilogram and 6. Stopping resuscitation efforts is around 20 minutes after birth if no heart rate. Thank you for watching the video. I hope you enjoyed it. Don't forget to subscribe and be sure to ring bell below in order to keep in touch with us for new updates.